I thought I'd show you, again, on table before and after surgery. So if we have a look at her goals here, she has moderate skin thickness. That's the first thing to bear in mind. It's not excessively thin, but equally not excessively thick. Around the tip, most people's skin is a little bit thicker, but her biggest concern that had been bothering her for a number of years was, again, the presence of the dorsal hump, which is a mix of bone and cartilage. And then she didn't like too much of the droop here within the nose itself. She felt as though that the nose was ever so slightly derotated, down-rotated, and wanted a slightly lifted but not overly corrected nose. And what I always warn my patients during surgery is the on-table photograph that you see hopefully will be an improvement, but it probably won't be the final result. Everyone's noses drop to some extent. There are certain techniques that we use to mitigate that, to limit the amount of fall, but with the effects of swelling, with the effect of gravity, over time the nose will fall ever so slightly. So you can see here, I have lifted the tip, I have rotated her a little bit more, but you can see here that she's got a much softer, balanced nasal dorsum, so that's reduced quite significantly. The tip here, although there's swelling, has already been narrowed as well, so she's got a much more streamlined profile. But the key to all of this, anytime we remove a dorsal hump, is to ensure that the breathing and the functionality is not impaired. So the septum must be straight, the mid-third, if appropriate, then needs to be reconstructed, depending on the type of technique that's used. And over time, the nasal swelling will get better over the coming weeks, over the coming months, and certainly final result, primary case, we're looking at about a year for everything to settle down.